and welcome to Movies That Matter. Today we'll discuss the film Wake Up: Stories from the Front Lines of Suicide Prevention. I'm Susan Suarez, President and CEO of the Holocaust Museum and Cohen Education Center here in Naples, Florida. The mission of Movies That Matter is to engage, educate, and facilitate discussion around human rights topics through film. This film series has been named in memory of Steve Brzezina, who was a museum volunteer docent and co-founder of Movies That Matter several years ago. The Movies That Matter series was founded in 2018, again, to discuss human rights topics through film. The lessons of the Holocaust teach us to have mutual respect for all people. The United Nations Declaration of Human Rights was created in 1948 in response to the horrors of the Holocaust. These film discussions hope to inspire participants to be upstanders for those facing these human rights challenges and abuses. As Elie Wiesel said, the opposite of love is not hate, it is indifference. So we encourage people to care about others and not to be indifferent. When we care for our fellow human beings, we can move a bit closer to our vision of a world that values mutual respect and is free of hate. I thank our committee, our partners, and our sponsors of the Steve Brzezina Movies That Matter series. So I hope everyone had a chance to see the film, but in case you haven't quite yet, let me just give you a little bit thumbnail sketch of it. It interweaves the stories of four very different communities that are affected by suicide: college students, veterans, the LGBT community, and gun owners. Wake Up focuses on the leaders on the front lines of prevention. And I think it leaves viewers feeling hopeful, informed, and encouraged. But of course, we also have several questions after watching the film. So to help us with those questions, and to get more details about how this issue affects our local Southwest Florida area, is we have our distinguished panelists with us today who know a lot about this issue. Sitting next to me is Dr. Robert Landy. He's a longtime Southwest Florida resident, provides mental health counseling services to those struggling with post-traumatic stress syndrome disorder, PTSD, especially veterans and first responders, and many of whom are 9/11 survivors. Dr. Landy is a U.S. Army veteran. Thank you for your service. As well as a formal special education counselor for Collier County Public Schools. His diverse experiences in counseling practice give him a wide perspective on the national mental health crisis and the work towards prevention. On your screen is Beth Hatch, CEO of NAMI Collier, a mental health support, advocacy, and education nonprofit in Naples. She joined NAMI in 2022 after serving as the head of Pathways Early Education Center of Immokalee. NAMI Collier is part of the National Alliance on Mental Illness Network that includes the national and state organizations and helps people and families navigate the complex mental health system and offers unique non-clinical programs and support groups that focus on wellness and personal recovery journeys. Dr. Landy, why don't we start with you and tell us a bit about your work. You've been doing this for quite some time.
Yes.
And some of the challenges and some of the successes that you've had.
Well, yes, I have been doing it for a long time. I've been a psychologist with schools. I've been in private practice since 1985. For about the last 15 to 20 years, I focused. Previously, I did work with all areas, including families and couples and children. And then about 15 to 20 years ago, I decided to kind of shift over to predominantly adults and specialize in post-traumatic stress disorder. And the majority of my work now is with veterans who are combat veterans, although I see others that are not combat veterans. I see 9/11 firemen, I see abuse victims. But I also still work with some adults in depression and anxiety, and I do a little bit of couple work still. You want me to touch on suicide now, or you want to wait?
Well, what were your reactions to the film in terms of the examples of PTSD? Folks suffering from PTSD and the work that was covered in the film.
One of the things I have found about PTSD is, in reading, is that there's generally two views of PTSD, post-traumatic stress disorder. One is that you can cure it, fix it. To my knowledge, to this day, including VA, which I think leans in that direction, but probably won't admit it, they've never come up with a program and or medication that consistently works with everybody all the time and sticks. They're getting close, and maybe they'll come up with something. The other view of PTSD is that instead of the cure, you're going to have it the rest of your life, and you're going to have the symptoms of that PTSD the rest of your life. But you could learn to change your response to the symptoms. And I'll give a quick example. About 6 years ago, a 6'2" Marine from Vietnam came into my office, and I had seen him before. And he said, "Doc, you have to help me with my anger." So I said, "Do you get angry in a vehicle?" And he said, "Of course I get angry in a vehicle." And I said, "You get out of the vehicle?" And he said, "Of course I get out of the vehicle with my baseball bat." So I said, "We're going to start right now." I said, "First thing you're going to do is you're going to hide that baseball bat somewhere in your garage. The second thing you're going to do is, as best you can, you're going to not get out of your vehicle. You can yell, scream, swear, do anything you want, but don't get out of the vehicle. It's a change of response to the symptom of anger." 2 days later, he brought me his baseball bat. It's in my garage now. My reaction to the film is that it was very informative. It gave, I think, an accurate portrayal of what suicide is all about, which is what we don't really know. There was a sense of hope, from my opinion, in the film, that there are people doing things about it and making strides. There was also a sense of my belief in what suicide is all about, and that's that we really still need more to know than we know, because we don't know why so many people commit suicide. Sometimes we get clues, sometimes we don't.
Okay, thank you. Beth. As Dr. Landy said, we don't know why some people are facing suicide. And there were many cases, many examples in the film where people said this was the last person who you would have expected to attempt suicide or commit suicide. So tell us a bit about your experience. And, I think part of this is, as we were talking about, indifferent, that so many people treat mental health and mental illness as a taboo subject, and it doesn't get the attention that it needs, and people might be afraid to ask for help. But tell us what your experience is.
Thank you. Thank you, Susan. I looked up just the stats to see, and I was just at our NAMI Florida conference last week, and from ages 10 to 14 for children and teens, it's the second leading cause of death, suicide is. For 15 to age 24, it's the third leading cause of death. And overall, for all ages, it's 12th leading cause of death. And I agree with you, Susan. Just in my life, from someone from college recently, a cousin, a very, very close friend's brother. I have almost 10 people that I just know from just my lifetime of, we won't say how long, that have died by suicide. And you are correct when you say we did not see that coming for so many. And it is our job, part of NAMI and all of us here that are here today, to be ambassadors to help that stigma go away. We have to get to a point where um, mental health, mental wellness is treated just as urgently as something physical, because otherwise we know that it does affect our physical health. I heard a speaker one time, and it always has just kind of stayed with me. There was a woman, her husband died of suicide, and her brother-in-law, within about a month and a half, died of cancer. And her 7-year-old son said, "But mommy, why is everybody so mad at daddy, but not mad at Uncle John?" And so that has always really stayed with me since I've heard that, because, there are things, you are absolutely correct, Dr. Bob. There's just so many, to find the right cocktails, to find the right therapy, there isn't always a fix, but as caregivers and for our loved ones, I think that's something that we have to remember. And we look at mental illness because of what we sometimes see on TV, right? We see some of the worst things through media, and we have to remember that there's someone's mom, dad, brother, sister, it's someone's loved one that really is calling for help. And even though we may not have seen or heard the callings, but there are some signs that we can, and we try to infuse that through, for all ages, what the different signs and warning signs, and then how do you do that? So even through our support groups for our families who have loved ones with mental illness, the camaraderie that comes out of those, to know that they're not alone, is so important, because it could be a completely different age group of a child. We had a couple join us this week that are in their 80s and their son is 53. Then another couple that joined us, their son is 19, but their stories were still very similar. And we serve veterans and seniors here, in college, all those transitions of life. Life just keeps getting harder and harder, as we know, and it's hard for people to cope. So lots of reasons, but part of our mission is really helping people recognize those signs and recognize that there is help out there, and that no one is alone on their journey.
Yes, and I'm sorry that Lonzo was not able to join us today, because we do want to find out about what resources are available to students, since you said that is the highest rate of suicide is among the young people. So both of you have worked with the schools also. So what can you tell us about, how many student age people does NAMI see, and do you think our schools are providing good support, or do they need more resources, or, which is a silly question. Of course, they need more resources.
Of course they do. I can speak of what we currently are doing, and just of this last school year, and then this current first month of school, basically. So NAMI, we are very, very fortunate to have grants and such through the Naples Children Education Foundation, and others that support our children's program. And our children's program is very, very unique to NAMI in general. We're really the only NAMI in the whole country that does what we do, and it's more program based because of the need that we have here in our community. So we serve Naples, Immokalee, Everglades City, all of Collier County. And we serve children from infancy all the way to 22, if they have developmental disabilities. This past year, we screened over 2,000 children. And from CCPS, kindergarten through 12th, we had a little over 700 children and their families in what we call care coordination. And that care coordination means we did home visits, which our team, we uncover a lot. We can see some of the basic needs that maybe that family needs, because you got to start at that basic foundational level. And then all the way, we were very, very fortunate to have no choice through grant funding. We added our own child psychologist and behavioral therapist on our team, because having qualified people like Dr. Bob here in our community is very, very hard for those that don't take insurance. The waiting list is incredible. And so a family and a child or a teen in crisis, they need something immediate. So we were able to eliminate the waiting game, so to speak, at least a minimum of 8 months to about a year and a half for evaluations to be done. And it's all about early intervention when we talk about younger children and teens. And our systems, because all our services are free, which makes it hard for, fundraising, but in the same breath, I hope it can always stay that way because we're not tied to insurance and having to see so many people per day and all of that. There's some staggering numbers for mental health that I think everybody in our and we hide it pretty well with with our seasonal community. Nationally, the number ratio for a mental health professional to the number of clients is 330 to 1. In Florida, the national average is 550 to 1. And in Collier, the average is 933 to 1. So to answer your question, yes, Collier, 933 to 1. And so, yes, the schools are fortunate to have a deputy. They're fortunate to have mental health therapists. But that's where we get into our housing crisis and all of that, trying to get professionals here and being able to keep them here that they can afford. So that's where we are very fortunate to be able to go into all of the schools, get the referrals. Just this school year for this first month, we've received 163 referrals for kindergarten through 12, and then another 62 from CCPS's pre-K program, and then 14 early learning centers that we also serve in the community. So it's all about getting them, identifying it, working with that family culturally. We hit a lot of barriers, lots of cultural differences, and not my son, not my daughter. It almost becomes like the system of grief, but we have to take them and handhold them through that process, whether it's the right placement in schools, whether it be at a doctor's appointment. A lot of just as all of you, we all know that if we were getting a cancer diagnosis, the first thing we say is, who's going to that appointment with you? So for mental health, that is where we come in. We are there with that family to make sure that we're advocating for that person. We do the same thing in our adult program for our seniors. So many of our seniors don't have someone here, so we attend appointments with them. If we attend one appointment, we could probably eliminate 5 more because we're actually going to make sure the follow-up is done for them. It's so incredibly important to know what to advocate for yourself. So we are definitely in the schools. We're doing diagnosis, and it's getting younger and younger. And you've all heard on the news, there was 333 as of last week threat attempts to Collier County campuses for schools. Some of them are just kids being kids, but they have to take each one seriously. So, and that does come into play.
Do you have bilingual staff? And what about language barriers with your clients?
We do. We are extremely fortunate to have bilingual staff, both in Spanish and Creole. So when we are in Immokalee or anywhere in Naples, we are able to meet their needs.
And do you think is there a NAMI of Lee County? And
there is, and we work with them closely. They are significantly different in their programs. They're more advocacy and referral, and that's just because of the community. Again, we're blessed here in Collier to have more program based. There's some NAMIs across the country that only have volunteers, and we moved into the former senior center a little over a year ago, so that allowed us to expand our services based on the need, and a lot of hard work showing that we're here, and we open the doors and they have come. So
right. Thank you. We are very lucky to have you here in our community.
Thank you. It's near and dear to my heart. My background is education and special education, and so whether it's a child, a teen, or a senior, we have to relearn skills. And there's help, and it's hard, and it splits families apart. So we're here for the whole family unit if there is one.
Dr. Landy, there's a question in the chat. How supportive is the VA in taking care of veterans with suicide issues?
That's a difficult question. Right now, there are 22 veterans a day that die by suicide. The VA is very aware of it, very consciously tuned into it. And anytime someone makes contact with VA, that is one of the questions they always ask. Are you going to hurt yourself or someone else? And depending on the answer, obviously, they're going to address it. Unfortunately, many of the people who even have any sense of conscious suicide attention don't acknowledge it. They don't say, "Oh yeah, I'm going to go kill myself tomorrow." You're right. A lot of people say, "I never expected that from that person." But sometimes there are signs that we miss. For example, one of the signs that I learned a long time ago about suicide was that they give away personal items. And when you see someone starting to give away their personal items, that doesn't mean they're going to do something tomorrow. But put your attention to that person and watch them. And I think that's important. I think the VA does the best they can. But again, like nationally, like the country, I don't think that they're doing enough. I think the VA has a way to go yet to address that, because think about Baker Act. In Florida, we have something called the Baker Act. And I'll simplify it, but basically someone that is a threat to themselves or others is Baker Act. It means that they get locked up without their permission for 72 hours and get examined by a psychiatrist. And if a psychiatrist asks them the question, "Are you going to hurt yourself or somebody else?" they say no. And then they let them out, and then the next day they shoot somebody or themselves. So again, I think more has to be done with that. I don't know if that answered the question. I think the VA has more to go.
Another group that was discussed in the community is the LGBTQ community. And part of what they talked about was that it's not necessarily mental illness that is causing the higher suicide rates. It's the lack of acceptance and the bullying and the depression that comes from that. So have you two had experience with that in your work as well?
I haven't directly, but I have it indirectly. I have a granddaughter / grandson that has decided she wants to be a boy. But she decided that 2 years ago, and I think that deciding something like that at that age is not only pressure on themselves, but something that may be decided differently in years to come. And I think there may be some amount of internal pressure to make decisions like that early by the community. But I think that I can certainly see that the community, think about how we treat people who are different. Think about how we treat LGBT people in the first place. And we meaning nationally, the people in the country. And someone who is a young person that is being treated that way doesn't have the psychological resources to respond to it appropriately. And they take their way out. And I want to respond to something that I can't remember who said it. One of you said it earlier. I don't think that people that commit suicide do so because they think there's a lack of resources they can go to and talk to. I think it's because they are in so much pain that is the only resource. That's the only way out. They try to escape from the pain.
Mm-hmm. one thing that was said in the film that struck me is, we often think that people who commit suicide or attempt suicide, should be thinking more about how they're going to hurt others and how it will hurt their parents and their family members. But really what they're thinking is how much better the other people's lives will be without them in it. Which is incredibly sad.
It is.
What about you, Beth, with the LGBTQ issue?
We definitely have encounter many each week. We partner with the Pride Center, and we are a referral for any of their clients. We work closely with the executive director there, Corey. You know, our adult program is from 18 all the way to seniors and veterans. So, and everybody says, you put them all together? Yes, because the world is all together and they learn from each other. So, our doors are open to everyone. But just as you said, it's that stigma. The majority are very alone because they, you know, I had someone that I just spoke to on Monday. He was here and he just said, if my family comes, remember I'm not here. And, you know, there's just not that acceptance. We still have the level of that, and that's, you know, in all different families and all different cultures. But that definitely is a big part of it. So, you know, we just try to give them the resources just as everyone else, that you know, they're not alone. But a lot of times they don't have that system of care that they need.
Mm-hmm.
So.
Right.
I did see a comment come through about Collier County, so I think you're addressing those too, Susan, right?
Yes, there's a question from Linda about how big is this problem with the elderly? And what can be done to help those who have significant physical or mental health problems change their feelings about living? Who would like to take that?
Well, I deal a lot with the elderly in terms of veterans, especially, and 9/11 firemen. And I am always tuned into that question because even though it's not brought up as a suicidal attempt or a thought, you watch these people truly struggle with deteriorating physical and mental abilities. And at some point, I look for, are they at a point where they're now getting ready to say, I can't do it anymore?
Mhm.
I'm always tuned into that because I think it's very real. And as their physical health and their psychological health decreases in their capabilities to deal with the world, they're going to say, that's it.
So can you give us some strategies? How do you help someone who says, I just can't do it anymore?
I think you have to continue to reinforce in them that there are other things, other ways of dealing with life. Some of which is giving examples of not necessarily specific people, but people who dealt with life despite very significant injuries, for example. You know, people who lost limbs and climb mountains. But that isn't always enough. That's all well and good for them, but not for me. But I think you have to keep focusing on staying positive and reinforcing the positive in their thinking and move them away from thinking the negative. And I have said many times, when you think that negative thing, is it accomplishing anything? And most of the time they say, no, it's not. And I said, then positive thing will do that. I don't care how little it is.
So ask them to think of some positive
Yeah.
things and talk about
And
those.
repeatedly do it.
Get
Just
them
do it
to focus on
over and
that.
over and over.
Mhm.
It's like grief. If you remember all the negative things about someone you're grieving, you're never gonna forget them. But you'll only remember the negative. But if you start going to the time you took a walk down there and ice cream when you were 7. Then you'll begin to focus on them in a positive way, the loss.
One of the other aspects of this in the film was legislation. And is there anything happening in Florida specifically that people should be paying attention to that could help with this issue, improving mental health awareness, or reducing the access to
I don't know.
to things that are harmful? Beth?
So, we only, how long do we have? I'm just kidding. So Florida, and I'm for so many, everyone's from somewhere else usually. Florida's ranked 50th in the nation for mental health services and funding. And that is not a place that we want to be. And so, and education is wherever I haven't seen the latest, but it is getting harder just with like those numbers that I just gave you, even in Collier County, 933 clients to one mental health professional. That's those numbers are staggering. And what's really happening is for those doctors, we have so many doctors that are going concierge because they're not dealing with insurance, they're not dealing with Medicare, they're not dealing with Medicaid, because their reimbursement rates are so very, very low. So for people getting services, it's extremely, extremely hard, especially if they are on a fixed income. 100%. We have a number of seniors, just to kind of piggyback on both questions, that we serve, and we do a depression screening for every age group that comes into our program. But that's just one of the first things that we do, and our seniors are the most vital for that, because so many don't have someone, and them getting up and coming to our adult program that we have each day, Monday through Friday. Which is totally free, that that's their reason to get up. And we see, I think it is definitely a Florida thing, so many don't have family members here. They just don't. And so it's hard to understand. When I lost my mom a year ago, I was advocating all the way to the very last breath at a vow. So it's hard to, but we fall into those footsteps to really advocating for so many, but the isolation is huge. So, and that, being able to relearn those skills, if it's working on a puzzle, right, and talking to others, that, you're increasing the fine motor skills, but it's not being alone. And that's what is so incredibly important. But the legislative part, there's not enough funding. There's not enough funding. Housing is an issue. Just our whole Southwest Florida in general. It's hard to recruit. Our workforce is an extremely critical situation right now. So sorry for the bigger bringer of bad news, but that's just where we're at. So
Let's piggyback on that, and going back to the VA. VA has 2 psychiatrists at the VA clinic in Naples. Two psychiatrists.
That's the nicest way.
Caseload is between 1,000 and 10,000.
Wow. What's your
yes.
By caseload, I have about 30 people I see in a week. Well, I'm not in a week, but over
but
time.
you can't retire because there's not enough in our area.
Well, and
Yeah.
that's very true.
It
It's
is.
very true. People dealing with PTSD is maybe, I would say, less than what you count on one hand.
Mm.
People in Collier County and Fort Myers. And the same thing with children. There are not enough psychiatric or psychological workers in the field, in the area, for children.
Right. I'm just wondering, Lonzo, are you Galaxy S23 Ultra by any chance? Who is that? Because I saw a message that he was going to try to join. No,
It's not.
if that's you, turn on your video so we can see your face. Okay. So also someone shared with us a report from the Kaiser Family Foundation that's titled Decades of national suicide prevention policies haven't slowed the deaths. So what do you say about that?
There we go.
Aha, Galaxy 3.
Okay. I'm so sorry. I have this little one here with me, so I had to pick him up from school today. So I'm listening to you guys. I kind of got in on the thank you. I kind of got in on the tail end of it.
So maybe
Go
you
ahead,
have
Anita.
something to say about this question about decades of national suicide prevention policies haven't slowed the deaths. But what has your experience been? You've been working in suicide prevention at Immokalee Middle School. You did that for many, many years as the school counselor. Did you see success from all the work that you did?
I will tell you, I'm most happy with what happened at Immokalee Middle School this year because we really, really pushed it. And so many kids came forth telling about their friends who were who were thinking about committing suicide. And so that was a great success because we did it for more than just that week. We really pushed it for the entire year, even though we celebrated it, not celebrated, but we really pushed it out there for we took a whole day out to advertise it on the morning news, to get the teachers involved with it, which is a very important piece of it. You have to get everybody involved in it, including administrators, and it really helped. So it's just how far and how hard you're willing to push everything out. And I am so proud to say that Immokalee Middle really did a great job.